So I work for an organization that it is called HACER, and I'm gonna start sharing my screen. And I haven't started the slideshow as usually it happens to me. So here we go. From the beginning, here we go. So here we are.
Well, we're seeing your presentation view still. So you either have to switch monitors or.
Yeah, I need to switch monitor. Just hold on a second. Bear with me, please.
Yeah.
And I'm gonna stop sharing. I'm gonna switch monitors right now. So meantime, I can tell you that I am currently in Mexico City. So I'm very happy to be with you in the distance. Also worried about what's happening in Minnesota. And seeing all the news is always kind of overwhelming. And especially with all the things we are learning about is kind of tough. So, but yeah, my heart is with you because I've been living in Minnesota for 28 years now, and I feel because that is pretty much what is happening. Half of my life is Mexican, pure Mexican, and half my life is Minnesotan, pure Minnesotan. So whatever is happening right now is hurting me, and that's why I'm going to be taking advantage of my opportunity to talk about Latinos in Minnesota, and because that's the work we do in the state. We work with Latinos, and working with Latinos, we are willing to bring something good for the entire communities of Minnesota. So what I'm going to be presenting to you today is a little bit of history of what it is HACER. We are going to be learning a little bit more if you don't know much about it. And I know there are a couple of experts here in the room. So Rodolfo, hello, you know more than me. So we are going to be talking about Latinos in Minnesota, how we are in Minnesota, and how we do work with them. I'm going to present two examples of that. And also going to be talking about the partnerships we work with. And I hope that is bringing to you an increased knowledge of who are the Latinos in Minnesota. And also I want to share the knowledge we have gathered through our work and have a greater understanding of the unique experiences of Latinos living in Minnesota. It is also something that came to me to surprise, as a surprise, because Latinos are usually in the U.S.-Mexico border, but we have a lot of experience here, and historically speaking, very long experience. So this is going to be something important for me to highlight. And this is something I want to be like very intentional. I want to inspire you by the lessons as we have learned about being able to network with different organizations to be the voice of the community and to be trusted messengers. So that is something I feel closely, related to my work, but also something that we've been trying to achieve and thus far a little bit successful. So start with HACER. So far, HACER is the only advocacy-driven Latino-specific research organization in the upper Midwest. As such, there are other organizations that are part of the colleges and universities, but they are not like us, a nonprofit, and they are not like us defined by birth, so to speak, as focusing on Latinos with nonprofit resources. So we were founded in 1988, and initially it was part of CLUES, today's Comunidades Latinas Unidas en Servicio. Back in time, it was Chicanos Latinos Unidos en Servicio, and but then it was the idea to create information about the Latino community as well as the Latino issues in Minnesota. Since then, HACER has grown and evolved to serve Latinos in Minnesota through research and focus groups, workshops, and programs. I mean, we've been developing all that and more. HACER became a nonprofit in 1997. So many people asked me if I created the organization. No, I didn't. I was not here back in time, but it was in 1997 when it became a nonprofit. And I joined the organization in 2007. The mission of the organization is to engage Latino Minnesotans through research, evaluation, and community action to promote equitable representation at all levels of institutional decisions and policy change. And one of our goals, and that is our vision, is that Minnesota is a state in which Latinos have pathways to justice and their voices and culture are lifted. And I do have a wonderful team working with me. Unfortunately, became reduced once we did have these changes last year due to the federal government adjustments. And we went down from 21 to today 30 people working, but they are still doing their best, and they are these people who I really thankful because they are working with me. You can learn more about it on our website. And let's talk about Latinos in Minnesota and why for me is so important. So I can tell you, in 1865, it was the first population counting by the census, where they wanted to try to consolidate how many people were living in here. And back in time, the Minnesota became the 32nd state just in 1858. So within a lapse of 7 years, more or less, it's 8 years, 7 years, it was reported by the census that 2 Latinos lived in Minnesota. In 1875, with the second census in the United States, 4 Latinos were reported in the state. There are rumors that the first one were a couple, and then they have 2 kids, and that's why they are 4 by 1875, but nothing proved yet. But what is interesting also, in 1886, the Orquestra de Mexico, that it is an orchestra created in Oaxaca, came to Minnesota for a series of concerts. And Luis Garzon, who played the oboe, he caught the flu, he got sick, and ended marrying with Clara Wagner, who, by the way, was the nurse who attended him back in time. And she was of German origin, also in Minnesota. Back in time, when they get married, he was just 19 years old. And when Garzon arrived to Minnesota, he carried a song, and he called that song "My Beautiful Minneapolitan." And bottom line, he has never been before in Minnesota. And the rumors also said that he was writing this song while he was in the airplane and asking about Minnesota. Knowing nothing, he wrote a beautiful song that making him married Clara Wagner. And the important thing is that after that, he stayed in the United States until 1954. He moved to Arcadia in Los Angeles, in California. But before he moved to California looking for better weather, he also founded an orchestra that today is the famous and very renowned Minnesota Orchestra. So this is a very important kind of topic to talk about, because not many people know about Luis Garzon and how important he was for the community. Now, a little bit of numbers. According to the 2020 census, and today estimates are very close of, or even a little bit over 400,000 people who declare Latin American ascendance. And with that also, it's important to recognize that according to the 2020 census, the Latinos in Minnesota contributed with 25% of the net population growth in the state. So without Latinos, perhaps we wouldn't be what it is today, Minnesota. And we're going to see the numbers later. Today, the estimation says that we represent 6.1% of the entire population in the state, and the average age is around 24 years, while the entire Minnesota has 38 as an average age. Minnesota accounts for close to 6 million people, according to the 2020 census and estimates for 2025. And as I was saying, 6.1 are Latinos, 6.4 are Black, non-Hispanic, 4.8 are Asian, and 1% is American Indian or Alaskan Native. Whereas 83% of the population is white. This is also something important as to where do we live. the largest proportion of people from Latino origin lived in the Twin Cities area, 63%. And this is followed by two other areas like Central and Southwest region and Southern region. So with numbers that are important, particularly for Southern region with 14%. So in the Southwest with 8% and the Central region with 8%. So those are combined the areas out of the Twin Cities more populated and then so important for us. If you put Latinos in a map, there's where we are. You see, there are the counties that have the largest number of people. This is Nobles County, where Working City is. And as you can see, there are other counties where the population in those counties of Latinos is 10% or more of the total. And it is important to call the attention to these northern counties where I'm going to be showing the next slide. There are Latinos and the proportion is humongous. And I am talking about Marshall and Jackson counties as well as Polk County. So they are in the northern part of the state. And no, Jackson is in the south. Sorry, Polk and Marshall are in the north. And you see 59% of the population is Latino there in Polk County. And in Marshall, 45% of the entire population. And I am just putting these two other columns for you to see how much more compared to the state and national proportion of Latinos living in these areas. As you can see, also the household income of Latinos or Hispanics is around the median is 70,000, but there are big proportion. I mean, the distribution is kind of even, except for 100,000 or more that it's not correct, is 3.7%. So it's not that big. Sorry for that typo. But yeah, the distribution is kind of even until less than $100,000, and the median income is of $72,000. But also, 50 households or 50,000 people are living below the poverty level that it is fixed in 14% of the entire population living in those conditions. So very quick kind of overview about the economics. It is considered that in Minnesota, an estimate is around 53,000 people who are undocumented coming from Latin America, and according to the Migration Policy Institute, in southern Minnesota, it is 11.6 thousand. If you see also the labor force participation is huge, while 47,000 of the entire Minnesota are working, Latinos who are undocumented. In southern Minnesota, almost everyone, 10,000 of them are working. So that is 48.1% of the entire undocumented population. I say percentage of Latin American foreign born population. The non-citizen population represent almost half of the population in these areas. The total Latino population in Minnesota, this is a time before the moment we are living right now, is 350,000. But in both cases, the population of the Latino population that it is considered undocumented is around 70%. So that is important for you to consider. Not even 20, not 25, but 60.6% of the population is undocumented. So when we did an interview about the contribution of people into the economy, this is what we found. More people are coming from Mexico, Honduras, El Salvador, and Guatemala. And the next slide, I guess, is a little bit more impacting because the employment is in direct, indirect, and induced. As induced is a little bit of estimation that it's going to add. We are going to see like the labor income that they are generating is over $462 million. And the output or the net contribution to the economy is over $1 billion or close to $2 billion per year in southern Minnesota. That is when we establish a high estimate that the contribution goes even close to $5 billion in southern Minnesota to the economy of the state. So that is what these so-called undocumented people, or say not, or yeah, without proper documentation, is contributing to the economy according to estimates we did with the support of the University of Minnesota. So in sum, if we consider these kind of estimates, we can go from $1.2 billion overall to $4.7 billion as the range in which the contribution of the economy to the economy from Latinos, undocumented Latinos in southern Minnesota goes to. So, but also I wanted to say we work a lot on focused on public health. And one of the biggest challenges and biggest work we have done is working within and after the pandemic of COVID-19. And because we do have a long history of building networks to reach out to participants that are in our different projects, we were called one night by MDH to see if we could collaborate. So the collaboration demanded immediate actions, and MDH contacted us to do so. And HACER all of a sudden was partnering with national and local serving organizations because we received support from CDC Foundation, HRSA, National Public Health Institutes, and all that. So we were seen as a good and trusted, I was pointing that out before, trusted connection and trusted messenger. And what is the context we were working on? First, Latinos faced various challenges during the pandemic, and the agriculture and service were deeply impacted. So the workers who were in those areas were impacted. The information was not immediately available in Spanish. As you know, everything was generated only in English. So this population needed to wait a long time until they know what to do. There were and still are limited services available in rural areas, particularly, and affecting health and services and transportation. And there's a lot of diversity in terms of language needs, immigration status, and more, which require adapting different strategies. I clicked the wrong key. So we established some guidelines of best practices that helped us to be working with that in this context. And we try to be strategic. We work with partners that establish audiences, and we look for community leaders in all places. Today, we work with a lot of community leaders from the local level of a neighborhood or a street to towns or even counties. And we try to be patient. We try to be moving at the speed of trust, because if we go faster, we are not going to be trusted, or if we too slow, even less. And we try to be consistent and showing up when we say we're going to be there, and we achieve that. Also, we needed to be creative because it's not easy to translate everything into Spanish, but also we needed to establish some cultural approaches. We share information with flyers, contacts, and resources, and we are still doing it. And we created relationships, and we try to show up when we say we were there. Good allies were the schools. So we are still working with a lot of schools in the state who are supporting what we are bringing to the community, particularly talking about resources, but also the supermarkets or grocery stores were big allies with us. So they are still opening the doors, even when they are closing the doors for obvious reasons. They are opening the doors to us to bring materials. And you can see a very large diversity of allies and partners who are working with us in public health areas. So also we are trying to use any and all communication tools that are at our disposal. We go in person, social media, use hotlines. We do have our own hotline. We are trying to bring materials in English and Spanish. And also when we communicate, we discover that talking in a simple word kind of language is better. And unfortunately, we needed to offer incentives. We're still offering them, both financial and non-financial, but people need to have that kind of reinforcement. Internally, we do have spreadsheets. You can count on them if you need data. We use the data to plan outreach, and we document testimonies along the way. And externally, we give people facts from trusted sources and share statistics and with the reasons and use data ethically. So pretty much is what we are doing. We've been learning along the process, and today we can tell you we are planning for as much as we can. We make time for both the big and small opportunities. We know that events are not just attended by Latinos, so we are ready to welcome larger diversity, and we are partnering with other organizations. We need to keep working together to avoid crisis in the future, and that is something I am pushing for today. We are even continuing vaccination events. We are offering comprehensive and recovery health information, and this is in high demand. We have COVID-19 testings, and we continue with our hotline open. And also, we are expanding our partnerships in and outside of COVID-19. And we have now partners in the region. We were lucky to have partners in Milwaukee, in Chicago, in Champaign, and in Iowa. We do have new partners to work with. So that is something that brings us to what is happening today in Minnesota. This is the Mercado Central, as you know, is very badly hit by what is happening. The colors are still there, but people are not coming to the Mercado Central. But we are still working in partnership with Mercado Central. These are a series of partners. Without them, we couldn't do anything. As you can see, they are diverse, from academic institutions to foundations to other, like the Chamber of Commerce, Latino Chambers of Commerce, and you see there Asian Media Access, which also among serving organization. The University of Minnesota is always there with us, and that is how we are trying to reach more and more. And our biggest partners have been the Department of Health, HACER, CDC Foundation, Ramsey County, the National Network of Public Health Institutes, and Anoka County and the Human and Services Division. Today presented our report on the survey on healthcare needs for Anoka County, Latinos living in Anoka County. So this is what I wanted to show you. This is my contact information. I am open always to be working with everybody because I love people. I feel unuseful when I am alone. So if I talk to people, I can bring ideas and share kind of projects and create new things. This is my also, if you want to scan it, you can find us there in social media. And we are in almost every single outlet. And well, with that, gracias, or thank you. And if you have any questions, please, or if you want to comment, please feel free to do it. And I really appreciate it because after this, I want you to reflect a little bit on what is going on. And I wanted to emphasize how important it is for us to think about the value of our immigrant communities, and not only that, how other communities are being affected when these immigrant communities are being affected as well, and what might be the cost. Today, we do have already seen ghost towns, as the Washington Post reported, because those areas were heavily foxed, but because there are a lot of immigrants, are showing this kind of situation where the businesses are closing. And yeah, you can say that they are immigrant-owned businesses, but that is affecting way beyond that. So it is important, but also how, historically speaking, Latinos, not only Latinos, but all the immigrant communities have been contributing to the state's wealth in so many ways, not only demographically speaking, but also economically. And well, Minnesota is also very cosmopolitan. I heard one person from Illinois telling me that we do have more diversity, culturally speaking, than Illinois, even though in Chicago. So that is Minnesota, and that is why I was trying to bring this information to share with you. And invite you to reflect and engage in a conversation with us. But yeah, I am open to your questions if you have any. Thank you.